My name is Francis, your clinical instructor for today. Today I'm going to show you how to document in the nurse's notes your TPR and your medication sheet, and especially your intake and output. Okay, so in this demonstration, you will need your black ball pen, blue ball pen, and red ball pen. You're going to use these pens differently according to your shift. Okay, so some institution they use black as a morning shift, blue in the PM shift, and red in the night shift. For our institution, we're going to use either blue or black for the morning and the PM shift, and red colored ball pen for the night shift. Okay, so let's go to the demonstration.
Good morning, guys. So in this video, I'm going to be showing you how to document in the nurse's notes. So disclaimer lang, this form is only used for educational purposes by the Davao Doctors College Inc. nursing program. Unauthorized distribution of this form is strictly prohibited. Davao Doctors Hospital reserves the rights to this file. Okay, so the purpose of this video is for the nursing students as a guide in order for them to know how to document in the nurse's chart. Okay, so first up, as a guide, we have to take into consideration that in the AM and PM shift, you can use either black or blue colored pen, and for night shift, you must use a red colored pen, except for writing the meds in the MAR or the MAR, the medication sheet, and carrying out doctor's order and heading. So you have to use black for that one. Okay. So let's start. So for the last name, so let's write a patient. Okay. So let's put here De La Cruz. It's very important that you fill in the headers in every page that you make. You have to write in the headers. Okay. De La Cruz 1 M, let's say 35 years old, you have your birthday 1985, then you have your room number, let's say 305. Okay, then you have our attending physician, let's say Dr. Bungo. Okay, now we have date, we have February 21 and 2021. Okay, so as you can see, we have allergies here, so you have to check if there is allergy or no allergy. Okay, so if there's an allergy, you have to write what type of allergy in this area right here. No? So if our patient has no allergy, you have to put a check on this mark. No allergy. Okay, no known allergy. Now, so it is divided into three sections. You have your AM, you have your PM, and your knock shift. No, so again for AM and PM, you can use either blue or black, but in the night shift you must use red. Okay, so for the ADL, means activity of daily living, so you have here your choices, so you can pick the status of the patient. So here we have activity as tolerated, CBR with BRP, CBR without BRP, and high backrest. Okay, so our patient, let's say, is having activity as tolerated, so you just put check on that one. Okay, and in the neuro section, uh, you have to pick. You have your conscious, alert, coherent, incoherent, aphasia, stuporous, and comatose. No, so you have to check which assessment you find the status of your client. So let's put in conscious, alert, and coherent. Okay. So for the responsive, responses to verbal stimuli or painful stimuli. So going to put here check the verbal stimuli. Pupils, you can put here pupils are uh, equal equally round and reactive to light accommodation or perla. Okay, so for the pulmo, so you have here respiration, dyspneic, apneic, or is the breath sounds are clear or has rails or rals. So for the patient, if there's no dyspnea or apnea, you can leave it blank. Okay, so for breath sounds, you have here clear, And then if the patient is using oxygen, you can put here oxygen. Okay, so let's say the patient is not using oxygen, so I'm going to leave it blank. uh, but if the patient is having oxygen, you can put how many liters per minute. Then you can check either if it is nasal cannula or multi-vent mask. Okay, for the cardio, you have your pulse. Yeah, check if it's regular, irregular, weak, and bounding. So let's say regular ang sa patient natin. You have your chest pain. If there's chest pain, you write character, location, and others. Okay. And for the gastro, you have your diet. Let's say the diet of the patient is low salt, low fat diet. Okay, then he's taking his food orally. And if in GT or OGT or transabdominal feeding, you have to include the size and the level of the NGT and the insertion date and the time. Okay, so for the elimination, for the urine, is it voiding freely with Foley catheter or with condom catheter? So our patient, let's say voiding freely. Okay, then color and amount. So you can write there yellowish, yellowish. Okay, so for the amount, it's okay if you don't write the exact amount because you can record this in the INO or the intake and output. Okay, so for integumentary, you have here assessing for the lips. Is it intact, moist, broken, or dry? So let's say it is intact and moist, and the skin is also intact. Okay. Skin trigger, is it good or poor? So if it's good, check good. Pressure injury. So if there's pressure injury, yes, then the stage or the size. So I'm just going to put in no. And then you have to put, if there is a pressure injury, you have to put the location, drainage, surgical site, and others. Okay. Then fall risk, identify the fall risk of the patient. It can be low, moderate, or high. So if it's low, you check low. Then always make sure that you check uh, the side rails is up. Okay, because you have to make sure that the side rails is up for the patient to prevent the patient from falling. Okay, then education the patient of and watcher, this is also a must. So you always have to do this so that you can check the yes box. Then after that, you have to sign in a nurse in charge. Okay, so let's say I am the morning nurse or student nurse, so I'm gonna put here morning student nurse. Okay, then you sign. Okay, make sure to leave a space because this is where your clinical instructor will countersign. Clinical instructor countersign your work, and then like that. Okay, so afterwards, so you have at the back, there's what we call your physician's visit. So when you're able to identify the patient's physician, and you note if the physician visits the patient, so you put the actual time of the visit, for example, let's say 10 a.m., then the name of the doctor, so Dr. Bungo. Okay, and if seen with orders or seen without orders, MGH orders or others, so you just put check. So let's say seen with orders, and then if there are any procedures done to the patient, so let's say 11 a.m., you have your CBC was taken. Okay, so you just put CBC done. Okay, then for the problem identification, so this is the charting of the nurse, no? So you have to put in the actual time. So let's say you begin your rounds with the patient and you found out that there's a problem, so you write there, say 8:30 a.m. Then the problem of the patient is, let's say, fever. Okay, then with temp of 38.7 degrees Celsius, and then you write in your interventions. So for example, you have your monitor, vital signs. Okay, then administer paracetamol 500 milligram per tab, one tab, PO as ordered. Then you can do provided with comfortable environment. You can also put there uh, tepid sponge bath rendered. Then lastly, watch out for unusualities. Then for the evaluation, so you can just put here still for monitoring. Later, after your shift, you can recheck, or after how many minutes, you can recheck for the temperature of the client, and you put in the evaluation with temp of, for example, the temperature of the client already went down due to your intervention, so you just put there with temp of, let's say, 37.4. Okay, so a febrile. Okay, then if that's the only problem for the patient, then you can leave it like that, so that another shift will continue the nurse's notes. Okay, so for the intravenous fluid, we have here time. So what time you received the patient, or you saw the IV fluid of the patient. So let's say around 8:30 a.m. Bottle number, so number one, you have your plain NSS 1 liter at KVO rate, and at, let's say you saw it at around 1000 ml at site, say right metacarpal vein. Okay, then you have your significant notes, if there's any significant notes. If there's none, then you just leave it blank. Then if transferred, you fill in the data accordingly. Transferred to ICU, CCU, you just check. Okay, then after that, you put in your name. Same, morning nurse, morning student nurse, and sign. Then you have here your clinical instructor, then sign. Okay, so usually the staff nurse will also countersign. Okay, so that's for the nurse's notes of the patient. Okay, so I will show you later some examples on the nurse's notes. So for the TPR sheet, so we have here the temperature, pulse, and the respiratory rate. Okay, so make sure you have your headings. So use black or blue for the headings. So date, let's say 0 to 21 and 2021. Then let's just make another date here, 22, 21, and 02, 2023, 2021. Okay, so when the patient is first admitted, so you have to start in day 0 and 1 and 2. Okay, so you have to start with day 0 because you start to measure day 1 after the first 24 hours that the patient is admitted to the hospital. Okay, and also don't forget the name of the patient, especially in your header. So we have here De La Cruz, we have here Juan, and Doctor Bungo. Okay, room number, you have your 305, and then hospital number, for example, is 123 4 5 6. Okay, so let's head to the temperature. So we have here, in starting for the temperature, make sure you encircle the normal value. Okay, so encircle for the normal value, that's 37. So it will signify uh, as the basis for the normal value of the patient. Okay, so if the patient was admitted for around 8 a.m., so here and then you check for the temperature. So as you can see here, so if we zoom, so this is the zoom. So we have here 37. So each dot is signifies a two interval. Okay, equivalent of 2.2. Okay, so this is 37. So 37.2, 37.4, 0.6, 0.8, and 38. Okay? For example, the patient's temperature is 37.4. So this is 37, 37.2, 37.4. So you have to connect this dot to 37. Okay? Then afterwards, for that is for 8 a.m. Okay? So that's for February 21, 8 a.m. Okay? So after that, if you're going to check for the temperature of the patient for around 12 p.m., okay? So the patient's temperature now is 37. Let's say 37. So 37 is here. You just have to connect it to the previous dot. Okay? And then so on and so forth. But it's very important that when assessing, especially for uh, night, so that's 12 a.m. and 4 a.m., you use red. Okay, so let's make an example. So we have here example 4 p.m. So again 30. You have here that the temp of the patient is 36.8. So this is 36.2, point 4, point 6, point 8. So you connect that. Then for 8 p.m. again same temperature, so just connect. Okay. Now if in when you take your vital signs for 12 a.m., so that's already for the night shift. So you're going to use red. So for example, around this time the patient had a 37.2 temperature. So you're going to mark the 37.2, then just connect the dot. Okay, using your red ball pen. Then 4 a.m., same. Use your red ball pen. For example, the patient had the same temperature, 37.2. So just uh, put the dot here, then connect it to the previous dot. Okay, so that's how uh, you you write for the temperature. Okay, and then for AM, let's say another shift, you use black again. Okay, so let's say for another shift, the patient had a 38.4 temperature, so you just connect right there. Okay, so that's how you make your temperature. Now let's go to pulse. Okay, so for the pulse, you do the same thing. So we have here in circle for the normal. So we have here 70. Okay, so for 8 a.m., so you know that this is 8 a.m., 12, 4, 8, 12, and so on and so forth. Okay, so for this, you have here 70, 60, 70, 80, so forth. So same pa rin, each dot is equivalent to uh, two counts, no? Two intervals. So 72, 74, 76, 78, and then 80. Okay, so let's say at 8 a.m. the patient's pulse rate was around 82. So you put it here. Then another at 12 o'clock, the patient's heart rate was around 92. So put your dot here at around 92, then connect. Then for 4 p.m., it's still the same 92. And then for 8 p.m., you have your 100. Okay, so the pulse was 100. Okay, then for 12 midnight, so it's the night shift now. So you're going to use your red ball pen. Okay, so around 98, say 98, connect. And then around 4 a.m., same 98. The result is 98, so you just connect. Okay, so once the shift is already morning, you, the nurse must use black. Okay, they must use the black um, colored ball pen. So we have here 102, for example. So it's going to look like that. Okay. So for respiration, so we have here same, encircle normal 20, and then you just have to count the respiration and then document it in your TPR. So for example, that the respiration of the patient was 14, so we have here 10, 12, 14, so you just connect it with 20. Okay, then so on and so forth. So same 14, then another, let's say 16, and it became 12. Okay, so at this point you have here the, it's going to be 12 midnight. Okay, so you're going to use your red ball pen. Okay, so for 12 midnight, around 12, then around 4 p.m., 4 a.m. again, 12. Then the next day, around 8 a.m., so you're going to use your black. So still same 12, RR, so like that. Okay. Now in putting in your blood pressure, so you have to place the result directly below the time it is, you took the blood pressure. So this is your 8 a.m. So just below, so you put in your blood pressure. For example, your blood pressure is around 120 over 80. Okay, then the next shift you have your 110 over 70. Okay, so and so on and so forth. Okay, so for night shift, still you have to follow, you have to use the red. Okay, so we have here, uh, 120 over 80, and another one, let's say 120 over 80. Okay, so you have to use red for that one. Then for the urine, usually in the urine, you count the urine in, output, and then after the shift, let's say you have 8 a.m., so you are 7 to 3 shift, so 8 a.m., 12 p.m., so you usually write down the number of urine output in the under the 12 p.m. slot. Okay, so for example, around two times, so you can use either numeral number, a Roman number, or numeral number. Depends on the institution. So if stool is zero, so you put zero. Okay. So again, so at the end of your shift. Okay. So you have to monitor it every shift, depending on the doctor's order. Okay. So that is how, this is how it's going to look. TPR. Okay, like that. Now let's proceed to vital sign sheet. For the vital sign sheet, so again, do not forget your headings. So you have here De La Cruz, 1, M, you have your 35-year-old male, birth January 1, 1985, and then let's say room number 305, the name physician, Dr. Bungo. Okay. IP number, let's say 1, 2, 3, 4, 5, 6. Okay. So we have here for the date, vital signs. So date, let's say we have February 21, 2021, then around 8 a.m. And you have to write your blood pressure. So let's say 120 over 80, pulse is 95, respiratory rate 12, temp is 36.5. If the patient experiencing pain, so you write pain scale, let's say 6 over 10, and then no need for urine if it is not QRly. Then you have your IV level at around 8 a.m. So let's say when you receive the patient, it's around 1000 ml. Then signature. So you have here, write in your family name, say morning SN. Make sure there's a space for the CI to countersign. Okay, so you sign there, and the CI will countersign. Okay, and after that, same. If usually you check your vital signs every 4 hours. Okay, depending on the doctor's order. It can be as much as Q 15 minutes, Q 30 minutes, Q hourly. and Q4, and you have your Q shift. Okay, usually the standard is around Q4 hours. Okay, then you have your another one, say same date around 12 p.m. So again, 120 over 80. Then you have your 90 pulse rate and 14 RR, let's say 37.0. And this time there's no pain scale. The patient is not experiencing any pain. And then at KVO rate, let's say you have your uh, after 4 hours, so the patient now has a 960 ml IV. Then you have to put in your signature, morning SN, then your clinical instructor will countersign. Okay? So, and so on and so forth. So, make sure that when it is night shift, you write in red. Okay? And then we have here for the IV flow sheet. So, patient's name. So, write in the patient's name. We have here De La Cruz. Then we have 1 M. Then we have room number 305. Admitting number 12345 6. Date is 021 0221 2021. Okay. Then age 35, male, under the service of Dr. Bungo. Okay. So example, we have the date here 02/21 2021. Bottle number 1, have your plainness S 1 liter at KVO rate. Volume is 1000 ml. So time started, let's say 8 a.m. Then remarks and signature for those who started, let's say ER nurse, then signature. Okay. Then if you discontinue, okay, if the doctor orders to shift the IVF, so you discontinue, so you have to sign here as well. Okay, in the time of discontinue. For example, time discontinue, you discontinued it at around 0 to 22. Then you have 2021 at 8 a.m. Okay, then so signature, you have your morning SN and CI will countersign. Then you insert, you change the IVF to another. So you have your 02 22, okay, 2021. Still, if it's a different IV solution, so you still have to put bottle number 1, okay, because it's a different solution. Let's say you have your plain LR, 1 liter at 100 cc per hour, okay, volume at 100 ml, okay, 1000 ml. Time started, say you started around 10 a.m. Okay, then you have your signature here, morning nurse, morning student nurse, then countersign by the CI. So with that, you made as you signed in the IV flow sheet 2 times. No, if you are discontinuing and you are uh, continuing with another IVF, or even if with the same IVF. Okay, so you have your signature here for discontinuing, and then you have your signature here for follow up. Okay, so that's how you document your IV flow sheet. Okay. For the intake and output, again, make sure that there is your headings. So we have here De La Cruz 1. Okay, M. We have your 35-year-old male, date of birth, okay, 1985, room number 305, the division Dr. Bongo. Okay, 1, 2, 3, 4, 5, 6. Okay, so we have here the date. Say you have your date is 02 21 2021. Okay, so this is for a morning shift, the PM shift, and the night shift. Okay, so for the oral, this includes your anything that the person or the patient drinks, no, orally. So let's say the patient was able to drink within 8 hours around 800 ml of water or fluids. Okay, then the IVF, since we are on KBO rate, let's say the patient was able to have 80 ml of IV fluid. So you total that one, we have around 880 ml for the intake. And then for the urine, if the patient was able to urinate for around 2 times within 8 hours, then you measured, wow, the urine output of the patient around 250 ml per urine output, so that makes around 500 ml. Okay, and then if the patient BM or has a bowel movement, so you can put how many times. So for example, once. Okay, then total, so we have here 500 ml. Then you have your signature. Okay, so we have here morning SN, then countersigned by the CI. So make sure if you are still starting, so you are not yet confident of your intake and output skills, no, so make sure that you, for before you write this down in ball pen, so you have to make sure that you start with writing it in pencil, no, so that you can, if there are any erasures, you can still erase, because you are not allowed to make errors with your pen, because as we know, the patient's chart is a legal document, no, so we have to make sure that there are no erasures in the chart of the patient. So if you are not yet sure, so make sure you use a pencil. Then once you are confident that the data that you have put in is correct, then you can finalize it with the pen. Okay. Then for night shift, so make sure that you use here uh, red no, red colored pen. Okay. Then after that, so for the total, it will be the staff nurse who will total the output. Okay, so that's for the intake and output. So let me show you an example of a finished product in the chart. Okay, so let's take a look. Okay, so here's an example. Okay, so as you can see here, we have here Juan de la Cruz. So Juan M, 36 years old, room 505, January 1, 1985. Then we have under service of Dr. Bungo. Okay, so date, we have our date, February 19, 2021. Okay, then for the morning shift, so we have here, we already checked in the details. So we have ADL, neuro, okay, and then we have the pulmo, cardio, gastro is already filled up, diet, we have your oral, elimination, integumentary, and then fall risk and the signature. Okay, so early morning nurse and then countersigned by the clinical instructor. So again, another PM nurse. Okay, so we have here for the PM nurse, so the patient had oxygen. So as you can see here, oxygen with 2 liters via nasal cannula. Then we have pulse is bounding with chest pain, character is stabbing pain, location at the apical area. Okay, then low salt, low fat diet, or we have here where NGT. So if the patient has an NGT, then write the size French 14. Then you have insertion date February 20, 2021, time 9 a.m. Okay, then if with Foley catheter, you check with Foley catheter, yellowish, then integumentary. Okay, same process, you have to sign and then let your clinical instructor countersign. Okay, for night shift, so as you can see, same process pa rin, but you have to use your red colored pen. Okay, so we have here activity as tolerated, conscious, alert, and coherent, verbal stimuli, perla, and things like that. Okay, so it's basically the same process but different color. Okay, so you have to assess the patient every shift. Then we have here, so seen February 19, 2021. So 9 a.m. by Dr. Bongo, seen with orders. So we have here CBC done. This is an example of the nurse's note. So we have 8 a.m. fever with temperature of 38.5. Monitor vital signs. So the morning nurse was able uh, to write down and take care of the patient with fever. And then after that, the PM shift. So we have here 4 p.m. Pan round. So the afternoon nurse noted pain at the right lower quadrant with pain scale of 6/10. Okay, so interventions. You have your monitor for vital signs, assess level of pain and characteristic of pain, provide paracetamol 500 milligram tab 1 tab PRN as ordered, encourage to do the breathing exercise, provide a quiet and clean environment, calm environment, watch out for unusualities. Then around 12 a.m., so you can see that the color of the pen is red because this is already the night shift. So we have here hypertension, BP of 140/80, and then interventions of the patient and evaluation. Still for monitoring with BP of 120/80. Then an intravenous fluid is all filled up, and then you can see that the color is the same pattern. No, so morning PM is black, and then night shift is red. Then don't forget to affix your signature and a space for the CI2 counter sign. Okay? And here's an example for the TPR. So as you can see, this is the for day 2 of the patient. So we have here, so red for the night shift. So just like that. It's the temperature. This is the pulse. And you have your RR. Okay, and then for the blood pressure, so as you can see here, so you have to write down the blood pressure, each blood pressure at the designated timeline. Okay, so we have 8, 12, 4 p.m., then 8 p.m., then for the night shift you have your red colored ones. Okay, then you have your urine and stool at every end of the shift. Okay, so you can use Roman numeral number or numerical number, depends upon the institution or uh, your station's preference. Okay, so we have here for the vital sign sheet. So as you can see, this is an example of the vital sign sheet. So make sure that you change the color when you are in the night shift. Okay, so we have here IV level. So checking of the IV level depends on the institution. Some, if you are VSQ4, so you have to check the IV level at the same time, VSQ4. But in some institutions, you have to check the IV level every 2 hours. So you have to adjust your vital signs taking every 2 hours also. Okay, so same process pa rin, just a change in timing. Okay, so let's say 8 a.m., 10 a.m., then 12 p.m., then 2 p.m., and then 4 p.m. So that's how you're going to check for the IV level. If because some institution, if your patient has an IV level, you are required to check the vital signs every 2 hours. So you have to follow what the institution requires you. Then we have our IV flow sheet. So here you can see that we have plain NSS at KVO rate. Then after uh, February 22, so it was consumed, and then morning nurse followed up with same plain NSS. So as you can see, if it's the same plain NSS and same rate, so you have here bottle number 2. Okay, then 1000 ml around 8 a.m. Then the morning nurse made a what do you call this, signature. Then around February 24, 1 a.m., night nurse followed up with the same plain as at KVO rate. So it's becomes bottle number 3. Okay? So make sure because the nurse is a night nurse, so night duty, so red ang kulay na ginamit niya. Okay? So red colored ball pen ang ginamit ng patient ng nurse. Okay? So for INO, intake and output, so this is an example. We have here uh, for the morning shift and then for the night shift. Okay, and also I've included if the patient has an NGT, you write it in the category of others, no? So sa others, so you have NGT, how many ml of feeding, you have your meds, and then you have your total, same pa rin. Then if meron namang drainage, for example post-op ang patient, you have your Jackson Spratt and other types of drainage, no? Or Foley catheter, so you write it in uh, dito. Okay, or Foley catheter, you can write it in urine, no? So since it's still urine, but then if merong mga drainage like Foley, Jackson Spratt, okay, so you write it in others. Then total pa rin. So once you get the total, then you affix your signature and make sure that there's a space for the CI to countersign. Okay. Then for the total, for the general total of the whole 24 hours fluid intake and output, it will be the responsibility of the staff nurse. Okay. So if you are instructed by the staff nurse to total, so you can also do so, no? So make sure na you use pencil first, so that if you commit an error, so you can easily erase, no? So once you are confident and sure of your answers, then you can use your pen. Okay, and then always make sure to let the CI counter sign, no? Everything you affix your signature in, the CI must be aware and the CI must be able to countersign. Okay? So those are the guides for documenting in terms of nurses' notes, TPR, and then you have your uh, INO. Okay? So for medication administration record, so this is how you're going to document um, your medication. So first, make sure that you write your headings. So we have here De La Cruz 1M, room number 305, birthday 0101, 1985, 35 years old, patient number 12356, under service of Dr. Bungo. Okay, so we have here, let's zoom. Okay, so we have here the date and time ordered. So let's say 02/21 2021 8 a.m. So we have let's say amlodipine 10 milligram 1 tab PO OD. Okay, so the timing here is 6 a.m. Okay, so we have here, this is 21, then 2020 21. Okay, then we have another medication, let's say 2021 around same time 8 a.m. So we have clindamycin, clindamycin 500 milligram uh, per tab. This is per tab, 1 tab TID. Okay, so let's say we have here 7 a.m., 1 p.m., 7 p.m. Then let's put another medication. Let's say February 21, 2021, 8 a.m. You have your ranitidine. Ranitidine, 50 milligrams per tab, 1 tab, BID, say 7 a.m. then 7 p.m. Okay, so then you have your date here, 22, then February 23, 2021. Okay, So uh, for medication, make sure you follow the correct color coding, especially if you are in the night shift. No, so for example, you're giving medication. So at the medication was ordered amlodipine 10 milligram 1 tab POOD 6 a.m. So let's say the medication was not given on the February 21 because it was still ordered and the patient had to buy the medication, for example. So you have to the next day, it was given on the next day. So you have to sign here. So 6 a.m. is for the night shift. So you make another line here. Then you sign here. Let's say night shift nurse, night SN, then countersigned by the CI here. Okay. So what you're going to do below, you're gonna write your name. So night SN, then signature and countersigned by the clinical instructor. Okay. Then another one, for example, uh, in the morning shift of the 2021, the patient was able to get the medication. So for 1 p.m., so you're able to provide the clindamycin. So when you give the medication at 1 p.m., so you make your signature here. So morning nurse, then your CI countersign. Okay, so right here. So morning nurse, morning SN, then CI countersign. Okay. So for PM, still the same. So this is already in the 3 to 11 shift. So say afternoon nurse, afternoon SN, then initials. Then you can do CI, what do you call this? Countersign here. Okay. So afternoon, afternoon nurse SN, then signature. Countersign by the CI. So the space here that you provided, this one, is allotted for the staff nurse. Okay, so this space right here is for the staff nurse because the primary giver or the primary caregiver of the patient is the staff nurse, the licensed staff nurse now. So with this three division, it shows that the signature of the student nurse or the initials of the student nurse. So student nurse, and then the counter signature of the clinical instructor. Okay, so basically, what you're going to do is divide the triangle into another triangle. For example, this one. Okay, so you divide it. So this is for the staff. Okay, for the staff signature, student nurse signature, and your CI. So this is the box that you're going to affix your signature. Okay. So for example, let's say clindamycin around February 22 was given by the student nurse, 500 milligrams. So put a division here. So let's say the medication was given around the morning shift. So you affix your signature here. So let's say your signature is student nurse, then affix the signature of the clinical instructor. Okay. Then allow for the staff to sign this area here. Okay. So that is how you sign your administration record.